Hello nurses and future nurses, welcome back to my YouTube channel, and on today's episode of Nurse Clement B, I am going to teach you on how to suction tracheostomy. That is tracheostomy suctioning, right? So sit back and watch this video till the end. Do not forget to like, share and subscribe to my YouTube channel at Nurse Clement B. And in case you have any question or any procedure you want me to do, please don't hesitate to drop it at the comment section. So do not forget to like, share and comment. Please join my membership. It is important, and I thank you for all the support you have been giving me, to my beautiful students and handsome students. Thank you very much for your support. Thank you for your support so far. So sit back now and let's go move on to tracheostomy suctioning. As a student nurse, as a student midwife, you may meet as a patient on tracheostomy. The secretions is much and you don't know what to do. So don't forget, sit back and watch this video till the end so that you can know how to suction a patient on tracheostomy. Okay, before you start suctioning tracheostomy, or before you start giving tracheostomy care, it is important as a student nurse or student midwife or a nurse that is practicing nursing to identify your patient first. Identification of patient is very, very important so that you can know the right patient that you are carrying out a particular procedure to avoid medical error, right? So now let's identify this patient. Good morning, my name is Nurse Clement and I'm here to remove this secretion that is on your neck on the tracheostomy. Can you please tell me your name and date of birth? The patient may say, this is my name and this is, and then you cross-check with what you have on your folder or system. Since the patient, he has told me he told me his or her name, right? Then I cross-check with the patient date of birth and number, right? So now that we have identified this patient and we know that this is the right patient, it is time for us now to explain the process, obtain consent and explain procedure, right? So my name is Nurse Clement and I'm here to take you to, I'll be your nurse for today, and I'm going to remove this secretion. It's much inside this tracheostomy. Is that okay? Is that fine? You may experience some discomfort like cough. You may feel like to cough. That's okay. So it will not take time. Is that okay? Can I go ahead? So the patient may say yes or no, but for this patient, the patient says yes. So I'm going to continue with this procedure, right? So now my requirement is set and it's ready. This is the catheter for suctioning, and I have my suctioning machine there. As you can see, my suctioning machine. Make sure that you have functional suctioning machine. My suctioning machine is here and the oxygen cylinder is there while the patient is on oxygen. You have to make sure that all these apparatus, they are functioning. And I have my requirements, the suctioning catheter. Remember, this is a sterile procedure, right? I have my suctioning catheter here, sterile glove. I have my saline, that is normal saline, and the inner cannula and the brush in case I want to change the inner cannula, in case the secretion is thick and I want to change it and I want to wash it. That is why we have the wire brush is here and the inner cannula is here too. So my requirement is ready, and I have a receiver down the bottom shelf for discarding used equipment, right? So now, before you carry out this kind of tracheostomy suctioning, you have to make sure that you check. After doing all this, you have to go and perform hand hygiene. Remember, it's a sterile procedure and my sterile field is already set, so I have to go and perform hand hygiene. So after performing hand hygiene, I'm going to don my gloves. So follow me, let's go and perform hand hygiene. So now that I'm done performing hand hygiene, it is time for me to don my glove. So I've done my glove. Remember, it's a sterile procedure. Try as much as possible to practice the proper way of putting on sterile glove. So the next thing is for us now to assess. Let's assess this patient to see whether this patient have the secretion is much or not. So now it's for us now to remember my hands are sterile. So you pick the sterile tube in the catheter. Make sure that you roll it this way inside your palm. Roll it this way, and then leave this edge that you can fix it to the suctioning machine. And remember that we have a suctioning machine here. Now that I've connected this, I've rolled it in my hand, I have to check if There are lots of secretion. Remember, you will not starve the patient of oxygen. So you always have to pull the oxygen this way and make your assessments. Does the patient have lots of secretions around the tracheostomy tubing? If the patient has a lot of secretions, then you suction, right? So after making your assessment, and make sure that you assess if there are rashes, if there are the patient is reacting to the necktie of the tracheostomy tubing. So you have to check around, just make your assessment if there are any abnormalities around the tracheostomy tube. So now I have my tubing for suctioning. So I have to connect. Remember, this my hand is what? Sterile. And I'm going to connect these two. Be careful so that you not contaminate it. You connect it to the what? To the suctioning tubing, right? So remember, since I've used this hand to pull the oxygen max, and I'm going to use the same hand since it's contaminated to connect the catheter to the suctioning tubing, right? So I've connected and I have my suctioning machine ready. So, and I suction. So you insert the catheter. For you to know whether this is functioning well, you have to dip it inside water. So as you can see, it's suctioning the water well. So the patient's tracheostomy tube, and then insert it right inside the patient's tracheostomy tube. Make sure that you insert it to the level that the patient coughs or you feel a resistance, right? As the patient coughs in, then while you are doing, please, you make sure that you twist suctioning catheter around in case if there are some thick mucus around the tracheostomy tubing, so it will help to suck it out, right? Then when you do, make sure that you do like 2 to 4 rounds. When you're, if in case in the tubing you notice that there are thick mucus on the tubing, then you come and suck the and clear the thick mucus inside the tubing, and then go in again, pull the oxygen face mask aside, and then suction again. Make sure you twist it a bit so that it will suction thick mucus around the tracheostomy tubing, right? And you do again and again and again until you have the desired results. Make sure that you do not starve your patient of oxygen. Whenever you are done, always try as much as possible to return back the oxygen max on the patient tracheostomy, and then you will make sure that you clear it, right? So done, you disconnect this and discard, right? And discard it into your receiver for used instruments. Now that you are done suctioning the patient, remember you have to remove you have to remove the inner cannula. As I said earlier on, if the inner cannula is dirty with thick if thick mucus adheres to the inner cannula, it is important now to wash the inner cannula and then replace it. That is where tracheostomy care comes in. Remember, this video only concentrates on suctioning of tracheostomy tube. That is it. So in case you need a video on tracheostomy care, please, I have a video and I will put it in my bio. Please go there and watch tracheostomy care by Nurse Clement B. And I love you all. And after doing this, you record the procedure that which you have performed. So before that, you remove the glove. You pull the glove, remove the glove, and go and perform hand hygiene, right? So follow me, let's go and perform hand hygiene before we record the procedure. After performing hand hygiene, the next thing is to record procedure. Remember, in nursing, any procedure that you carried out and you do not record, that procedure is as good as not being carried out, right? So you carry your pen and paper if the hospital warrants that, or you record it in the computer, right? So you record what you have observed around the tracheostomy while you are trying to suction the tracheostomy, right? Or where the secretion was it thick, Was there blood? Or anything that you observed during the assessment, you record it, right? So it is important to record all this. Thank you for staying with me till the end of this video. Thank you for your support. Thank you. At Nurse Clement B is saying bye-bye.